The United States is a multicultural society made up of people coming from different countries, cultures, and religions. This diversity is reflected in an increasingly complex religious profile and growth in the number and size of non-Christian religious communities. Death is common to all of us, yet the way different cultures and religions view death and the dying process differs dramatically. These different views and ideologies have led to a multitude of practices and rituals related to death and the dying person, which may be critical to the peace and comfort of the dying and their family. In our society, care of the dying has increasingly become a matter for professionals. While being experts in their area, many healthcare workers may not be aware of the beliefs, related rituals, attitudes towards death, and patterns of emotional response prevailing in the cultural background of their clients. It's hard to be prepared for death, be it our own, a loved one's, or in our field, a client. Too much is unknown about what dying feels like, or what, if anything, happens after death, to ever feel truly ready. However, we do know a bit about the process that occurs in the days and hours leading up to natural death, and knowing what's going on may be helpful in the dying's last moments. During the dying process, the body's systems shut down. The dying person has less energy and begins to sleep more and more. The body is conserving the little energy it has, and as a result, needs less nourishment and sustenance. In the days or sometimes weeks before death, people eat less and drink less. They may lose all interest in food and drink entirely, and you shouldn't force them to eat. In fact, pushing food or drink on a dying person could cause him or her to choke. At this point, it has become difficult to swallow and the mouth is very dry. As the person takes in less food and drink, he or she will urinate less frequently and have fewer bowel movements. The person may also experience loss of bladder and bowel control. People who are dying may become confused, agitated, or restless, which could be a result of the brain receiving less oxygen. It can be disconcerting and painful to hear a loved one so confused in his or her last days. The skin will also show the effects of slowing circulation and less oxygen. The extremities and later the entire body may be cool to the touch and turn blue or light gray. Some skin may exhibit signs of mottling, which is a reddish-blue blotchiness. As the person gets closer to death, it will become harder and harder to breathe. Respiration will be noisy and irregular, and it will sometimes seem as if the person can't breathe at all. When there's fluid in the lungs, it can cause a sound known as the death rattle. It may be possible to alleviate the gurgling and congestion by raising the person's head and applying suction. If the person dying is experiencing pain, he or she will be usually given medications to manage it. When we're watching someone die, we may have a preconceived notion of how the person should handle death emotionally and spiritually. It's important to remember that every person experiences dying differently. Some people have the need to say goodbye or to hear from another person before death. Some don't. Some people prefer to partake in religious rites, while others remain silent until the end and pass away when everyone has left the room. Doctors and other professionals who manage end-of-life care advise loved ones to take their cues from the dying and avoid projecting their own desires or needs onto that person. They also urge loved ones to continue speaking comfortably to a dying person, as hearing may be one of the last things to go. Clinical death occurs when a person's heartbeat, breathing, and circulation stop. 4 to 6 minutes later, biological death occurs. That's when the brain cells begin to die from lack of oxygen, and resuscitation is impossible. Death and dying are an inevitable and pervasive feature of life, yet we tend to shy away from the prospect of our own demise. For obvious reasons, the topic is emotion-laden, confusing, and frightening. At the same time, facing death can be a meaningful and transformative process. In some cultures, one's death is considered to be the will of a supreme deity, or the passage to a better world, and thus not a tragedy. But for many in the West, the traditional rituals and discourses around dying have gone the way of our other lost rites of passage. As the baby boomers age, the topic of death and dying has gained attention in the United States. Thanatology, the scientific study of death and dying, death education courses, and the hospice movement are all signs of this changing awareness and point toward the growing desire to integrate the inevitable. Modern embalming is our Western medical way of dealing with the dead body. The modern method of embalming is defined as the disinfection and preservation of the human dead body. It is performed for 3 reasons. The primary purpose is disinfection. The second purpose of embalming is preservation, and the third purpose is restoration. Returning the body to a lifelike appearance has received many critics, but the custom of viewing the body after death in a state of rest remains a proven psychological practice. The modern embalming process is designed to retard tissue decomposition for the period of time necessary for disposition as arranged by the family. Under favorable conditions, however, modern embalming has been shown to be able to keep a body intact for decades. Rather than prevent the body from returning to its natural elements, embalming allows the body to decompose by oxidation and dissolution rather than by putrefaction or rotting. Embalming is accomplished by a chemical fixation of the cell protein. In modern embalming, then, an embalming fluid is both a disinfectant and a preservative and is injected into the circulatory system of the body by an electric pump, while the blood is forced out of the body and disposed of. In effect, the blood is replaced with a disinfectant and preservative solution. The normal steps to preparation of the body consist of the body being placed in proper position on an embalming table with the arms laid over the stomach. The body is washed and disinfected. The face is shaved as necessary. The eyes are closed, and this is usually accomplished with a small plastic curved disc called an eye cap placed under the eyelid. Perforations in the cap help hold the eyelid in place. The mouth is closed. This is usually accomplished by the placing of specially designed tack in the upper and lower jaw. Each tack has a fine wire attached. By twisting the two wires together, the jaw is thus closed and the lips are set to a natural lip line using a cream to retain the proper position and to prevent dehydration. The embalming solution is prepared. The modern embalming machine consists of a 2 to 3 gallon reservoir and an electric pump. A solution of approximately 8 ounces of fluid to 1 gallon of water is prepared. An incision is made over the carotid artery or the femoral artery, and the artery and vein are located and isolated. A tube which is attached to the machine is inserted into the artery. A slightly larger tube is placed into the accompanying vein. This tube is attached to a hose to the sewer system. The fluid is injected into the artery under pressure by the embalming machine. As the blood is displaced by the fluid going in, it is forced out of the vein tube and disposed of. The pressure forces the embalming fluid into the capillaries and eventually to the cells of the body. After approximately 3 gallons of solution are injected into the body, the blood has thinned and the fluid coming through the vein tube is mostly embalming fluid. The tubes are removed and the incision sutured. The abdominal cavity is treated by the use of a hollow tube called a trocar that is used to aspirate gases and liquid content under suction. A preservative chemical is then introduced. The body is again washed and cream is placed on the hands and face to prevent dehydration. The hair is shampooed and the fingernails cleaned. The body is covered with a sheet awaiting dressing and placement in the casket. Cosmetics are later applied to replace the natural color removed by the embalming process, much of which is created by blood and facial capillaries that is no longer present. In the case of women, cosmetics used in life may also be used to recreate the look that the person had in life. Their hair is combed or set. We would like to think that in these modern times our state of enlightenment would have totally dispensed with the thinking that all death is approached from a standpoint of fear. Many of our funeral customs have their historical basis in pagan rituals. Modern mourning clothing came from the custom of wearing special clothing as a disguise to hide identity from returning spirits. Pagans believed that returning spirits would fail to recognize them in their new attire and would be confused and overlook them. Covering the face of the deceased with a sheet stems from pagan tribes who believed that the spirit of the deceased escaped through the mouth. They would often hold the mouth and nose of a sick person shut, hoping to retain the spirits and delay death. And also, this is the root of our closed mouth treatment. Feastings and gatherings associated with the funeral began as an essential part of the primitive funeral, where offerings were made and mourning began. Wakes held today come from ancient customs of keeping watch over the deceased, hoping that life would return. The lighting of candles comes from the use of fire in an attempt to protect the living from spirits. Practice of ringing bells comes from common medieval belief that the spirits would be kept at bay by the ringing of a consecrated bell. And the firing of a rifle volley over the deceased mirrors the tribal practice of throwing spears into the air to ward off spirits. Originally, holy water was sprinkled on the body to protect it from demons. Floral offerings were originally intended to gain favor with the spirit of the deceased. And funeral music had its origins in the ancient chants designed to placate the spirits. In many countries of the modern world, the practice of burying the dead is common. However, it's a relatively new concept by some standards. In some places, it's almost a novelty. In fact, many of today's contemporary funeral practices might be considered a bit strange by our ancestors. There is such a wide variety of funeral practice throughout history that it's worth taking a look at. In fact, archaeologists have learned that studying the treatment of the dead can actually give them a clue to how a culture lives. Every society throughout history has found some way to attend to the proper care of their dead. Here are some different methods in which various cultures have said farewell to their loved ones. On the island of Sulawesi in Indonesia, newborn infants who die are buried in the trunks of giant trees. The people there believe that the child's soul will rise up into the heavens through the tree. Many cultures, such as the Mayan and the Egyptians, bury their dead It's okay. Bury their dead in tombs that were part of ceremonial centers. Multiple burials were often contained in the same pyramid or plaza. Early burials were often built over later generations, making these sites a bit of a puzzle for researchers. And even the ancient Chinese buried their rulers in suits of jade just before internment. Archaeologists have unearthed the tombs of Neanderthal man, dating back to 60,000 years before Christ existed, at the Sandham cave in Iraq. The graves included animal antlers placed on the body and flower detritus nearby. This may indicate that some sort of ritual took place even 60,000 years ago. To a person living during almost any other time or in any place in the world, modern American burial traditions might seem odd. We preserve the deceased's body with chemicals and cosmetics to give the illusion of life, also that friends, family, and well-wishers can come to view it and pay their respects. To some, our attempt to make the burial process as sterile and lifelike as possible suggests a profound discomfort with the realities of death. Death is an inescapable part of life, and the manner in which bodies are handled across cultures depends on the surrounding society, religion, geography, and resources, as well as the deceased's individual social and, in many cases, financial status. The very rich and powerful may get Taj Mahals and great pyramids, but for most people around the world, burial is simple, intimate, and sacred. Hindus believe that the body traps the soul after death, and the only way to release the soul into its next life is through fire. In India, when a good Hindu dies, a lamp stays burning throughout the body's preparation, symbolizing a guiding light that will shepherd the person's spirit into the next life. The body is ritually cleansed, dressed in new garments adorned with herbs, jewels, and flowers, and taken to a ritual cremation area and placed on a funeral pyre. A chief mourner, often the deceased's oldest son, performs sacred rites and then sets the pyre aflame. As the body burns, the chief mourner performs a rite called Kapal Kriya, in which he cracks the deceased's skull with a bamboo rod to symbolically release the soul. After a few days, when the cremation is done, he returns to the pyre, collects the ashes and remaining bone fragments in an urn, and inters them into the sacred Ganges River. Jewish burials. In Judaism, the body of a deceased person holds a status similar to a Torah scroll. It deserves the utmost respect and reverence. The body is treated with dignity, and great care is taken to avoid ostentation or vanity. Jewish law forbids embalming and adornment with cosmetics, which are seen as desecrating. Autopsies and organ donation are discouraged. The body is prepared for burial by being wrapped in a simple white shroud and placed in a plain wooden coffin without viewings or wakes. Between the time of death and the time of burial, which takes place as soon as possible, a guardian or shomer sits with the body, even overnight, to watch over it and recite psalms. At the cemetery, mourners each take turns throwing shovels of soil into the grave, performing a final good deed for the deceased. Traditional Chinese burial. Because of ancient superstitions, the Chinese take burial and funeral rites very seriously. The older and more respected the deceased was, the more elaborate his or her funeral or burial. The body of the deceased is washed and dressed in his or her best clothing, preferably in colors like blue, black, or brown, but never red. Red represents happiness and is usually considered taboo at funerals, unless in the case of a deceased who is over 80 years old. Funerals of the very elderly often include red details to celebrate their long life. Before being placed in a coffin, the body is covered with a light blue cloth, while the face is covered with a yellow one. The coffin is displayed in the home for a wake, where mourners and relatives place offerings of food and paper money to be used in the afterlife, as well as incense and burning candles. After funeral services, the body is buried in the most auspicious grave site that can be found, according to the principles of Feng Shui. Graves on a hill are most desirable. Families take great care to arrange funerals in the most auspicious and traditional manners possible, since not to do so is to invite bad luck and poor fortune. After burial, descendants travel to their ancestors' grave sites every April for a grave sweeping day, when they tend the gravesite and leave more offerings of food and money. In China's Donghai region, though, funerals are actually a status symbol. A dead man's reputation and honor is considered to be directly proportional to the number of people who attend his funeral. So the relatives have started hiring strippers to pull in the crowds. The Chinese authorities have started cracking down on this practice after incessant media glare has shined a negative light upon the practice. Believe it or not, the Malagasy and Madagascar take the dead out of their graves and dance with them. The belief behind this ritual, called Famadihane, is that the spirit of the deceased joins the ancestors after the body has decomposed. The celebration is often held once every 7 years and is a time of joyous family reunions. On the tiny island of Kiribati, the deceased is laid out in their house for no less than 3 days and as long as 12, depending on their status in the community. Friends and relatives make a pudding from the root of a local plant as an offering, and several months after interment, the body is exhumed and the skull is removed, oiled, polished, and offered tobacco and food. After the remainder of the body is reinterred, traditional islanders keep the skull on a shelf in their home and believe the native god Naka welcomes the dead person's spirit into the northern end of the island. In Mongolia, lamas direct the entire ceremony with their number determined by the social standing of the deceased. They decide the direction the entourage will travel with the body to the specific day and time the ceremony can happen. Mongolians believe in the return of the soul. Therefore, the lamas pray and offer food to keep the evil spirits away and to protect the remaining family. They also place blue stones in the dead person's bed to prevent evil spirits from entering it. No one but a lama is allowed to touch the corpse, and a white silk veil is placed over the face. The naked body is flanked on both sides by men and women, and both have their respective right or left hand placed under their heads, situated in a fetal position. The family burns incense and leaves food out for all the visitors. The body is finally taken away from the village and laid on the open ground. A stone outline is placed around it, and then the village dogs that have been penned up and not fed for days are released to consume the remains. What is left goes to the local predators, such as birds of prey. The stone outline remains as a reminder of the person. If any step of the ceremony is left out, no matter how trivial, bad karma is believed to ensue. In Tibet, there's a similar ceremony to Mongolia. The deceased is dismembered by a rogyapa, or body breaker, and left outside, away from any occupied dwellings to be consumed by nature. To the Western mind, this might seem barbaric, as it did to the Chinese, who outlawed the practice after taking control of the country in the 1950s. But in Buddhist Tibet, it makes perfect sense. The ceremony represents the perfect Buddhist act, known as jator. The worthless body provides sustenance to the birds of prey and predators in the area that are primary consumers of its flesh. To a Buddhist, the body is but an empty shell, worthless after the spirit has departed. Most of the country is surrounded by snowy peaks, and the ground is too solid for traditional earth interment or burial. Likewise, being mostly above the tree line, there is not enough fuel for cremation or caskets. The Maasai of East Africa are hereditary nomads who believe in a deity named Enkai. But this is not a single being or entity. It's a term that encompasses the earth, sky, and all that dwells below. It is a difficult concept for the Western minds that are more used to traditional religious beliefs than those of so-called primitive cultures. Actual burial is reserved for chiefs as a sign of respect, while common people are simply left outdoors for predators to dispose of, since the Maasai believe dead bodies are harmful to the earth. To them, when you are dead, you are simply gone. There is no afterlife. Zoroastrians in India believe that after death, the body becomes a host for corruption and defilement. Cremation or burial are ruled out because they might end up polluting sacred elements like fire and earth. So they go for a ritual called exposure of the dead. The deceased's body is taken up to a raised structure called the Tower of Silence and left there to be devoured by vultures. The practice is now only followed by the Indian subcontinent. Dwindling vulture population in India has made the process more gruesome. Some recent photos showing a growing heap of rotting cadavers atop the tower in Bombay, which is one of the most highly populated cities in India, have stirred controversy within the community. I'm going to skip this one. Since most of our planet is covered with water, burial at sea has long been the accepted norm for mariners the world over. By international law, the captain of any ship, regardless of size or nationality, has the authority to conduct an official burial service at sea. The traditional burial shroud is a burlap bag. The deceased is sewn inside and weighted with rocks or other heavy debris to keep it from floating. If available, the flag of their nation covers the bag while a service is conducted on the deck. The body is then slid from under the flag and deposited in Davy Jones' locker. In olden days, the British mandated that the final stitch in the bag had to go through the deceased person's lips, just to make sure that they were really dead. If they were still alive, obviously having a needle pass through their skin would revive them. It's quite possible that sea burial has been the main form of burial across the earth since before recorded history. Although associated most strongly with mariners, burial at sea has been in practice for millennia among people all around the world. Coastal and especially island communities for whom land is too precious to use for cemeteries, that rely on the sea for sustenance and trade, have long committed their dead into the ocean. This allows bodies to decompose quickly in the water and complete the cycle of life. Egyptians and Vikings floated bodies out to sea on rafts or boats. In modern times, the most sea burials involve simply the sprinkling of cremains, although some companies still specialize in full body burials. Interesting side note, does anyone know who was recently buried at sea and why? Osama bin Laden, exactly. Anyone know why he was buried at sea?
So they would be buried within so many hours.
So that there would be no worshiping place so
That's,
we wouldn't be martyred.
that's the government reason behind doing it, so there's no worship place or place of martyrdom anywhere in the world for terrorists to worship. But it was also the most expeditious way to bury them, which is in keeping with Sharia Muslim law. It has to be done as soon as possible, but they tend not to do burial at sea as part of their purpose. I think, let's see, I have several more of these historicals. I'm going to jump through most of these. Funeral pyres, Viking burials, cave burials still go on in Hawaii. There are many caves all over Hawaii, and especially in Maui. And traditional Hawaiians will have a burial that takes place in a cave where the body's bent into a fetal position with their hands and feet tied to keep it in that way, and then covered with cloth made from mulberry bush. The bones are considered sacred and believed to have divine power, and many caves in Hawaii still contain these skeletons.
Still legal?
Yes. This might be the worst death ritual ever. Endo-cannibalism is a practice where people eat their own dead. The idea behind the horrid custom could be, and horrid should be in quotes because to them it's not horrid, obviously, and you have to respect their culture. Could be anything, from imbibing the deceased's traits to assimilation of the spirit. Few tribes in South America and Australia are said to have practiced this creepy ritual, but many academics feel that endo-cannibalism is a false accusation thrown at tribes by early colonists to gain an excuse for political domination. However, according to anthropologist Napoleon Changon, the Yanomamo community in South America still eats the ash and ground bones of the deceased after cremation, and modern-day women of the New Guinea tribe have a ritual that involves eating the flesh of the deceased men of their tribe. Vimla Devi, an Indian woman fighting cancer, died in 2006. The cause of her death was not cancer, but a 13-day fast called Santhara. This voluntary death by fasting is practiced by the Jains, a community that believes in nonviolence towards all creatures. Santhara is usually initiated after the person decides that life has served its purpose and is ready for spiritual purification. There is growing opposition to the ritual, which is often seen as a form of suicide or euthanasia, but within the community, preventing Santhara can invite ostracism. This is a self-mummification process that Japanese monks go through. I'll skip it, but it's strange. And they sit in a cave and sound a bell daily, letting their colleagues know they're alive. And when the bell finally doesn't sound, the colleagues go up and seal the cave. And then 1,000 days later, open the cave back up and check on the mummified body, and then treat the mummified body to a ritual of honor. In Ghana, they have a really advanced casketry behaviors. If Elvis died in Ghana, he probably would have been buried in a guitar coffin. They bury their dead in fantasy coffins, and the casket often represents the profession of the deceased. Giant replicas of Coke bottles, fruits, or gadgets are displayed in coffin showrooms. This is actually what I want to do with myself. People can now wear their loved ones on their fingers. An American company called LifeGem now offers people a chance to turn their dead loved ones into synthetic diamonds. The process starts by capturing carbon from the cremated remains of the deceased. It is then turned into graphite before putting it into a diamond press to obtain the shiny crystal. Price ranges from $3,500 to $20,000 depending on the carat size. Today, if one has enough money, you can be launched into space aboard a private commercial satellite, and a capsule containing your ashes will be in permanent orbit around the Earth. Perhaps this is the ultimate burial ceremony, or maybe the beginning of a new era in which man continues to find new and innovative ways to invoke spirits and provide a safe passage to whatever awaits us at the end of this life. But whether a culture hangs coffins on a mountaintop and tombs their dead in monuments, utilizes mass graves, or shoots them into outer space, their methods of interring the dead speak volumes about their culture and their feelings on life itself. When dealing with death, it's important to consider a family meeting. Sorry. The key decision maker may not be the same person as the primary caregiver. Be aware of family dynamics and power relationships. Although people with moderate comprehension of English may appear to understand the discussions, use a professional interpreter to communicate complex medical information. Offer the family the opportunity to have a priest or religious advisor in attendance and to assist with prayers and other rituals. Do not hesitate to ask about other relevant cultural aspects. It is very respectful to show an interest in other cultures. Ensure the family and patient understands the benefits that palliative care can offer. Reinforce to the family that the patient can be in more control if better informed. Identify and respect protective behavior of the dying by family members who care. Allow time and be aware of customs that show respect. This will help establish a strong rapport with the patient, family, and their friends. Use written materials to help disseminate information to all family members and others. And if basic information is given, this can be followed by an invitation to ask questions. The questions will indicate the questions may indicate to us some information about the speaker as well as clarify their expectations of us. Beware of possibly high expectations that doctors and nurses may be expected to completely relieve all symptoms. Do not assume the patient will have an extended family that is able to support the dying. They may be there alone. Seek out culturally specific community services that apply to those dying. Where these are not available, discuss patient and family needs with local service providers. If a referral to community services initially declined, keep trying, seek further opportunities for referral. Attempt to accommodate, within reason, the large number of visitors for a hospitalized patient. I got shuffled up here. Although emotional support may be declined, recognize anxious behavior and assess if this is an appeal for help. Anger that may be directed at you should not be taken personally. Be prepared to seek additional support for yourself if required. Attempt to establish beliefs and fears surrounding the pain-relieving medication and show sensitivity and understanding towards patients who may resist using pain medication. Use published materials to educate the family and patient on the benefits of morphine and to dispel myths. Introduce information gradually using non-medical terminology and assess if it's being understood. And recruit assistance from other community services if necessary. Above all, treat each person as an individual. To assist someone from another culture, we must set aside our own beliefs and seek to understand the needs of the other person. Some concept of basic tenets of other cultures and religions will assist us, but we must resist the urge to categorize. Provision of material in different languages or provision of an interpreter may assist, but these do not address issues of individuality, nor the importance in some cultures of a person's place in social stratum. We must learn about the beliefs of the person before us. We should try to gain an understanding of the depth of those beliefs, and we should learn whether their religion is whether their religion is more important than other aspects of their culture related to their country of birth. These factors may impact how we treat or support the person and their family. When many people age, develop dementia, or become ill, they revert to their native tongue. This is a comfort zone, and although you may be aware that the person is quite fluent in English at this time, it may be important to understand that there is a preference for communicating in their native tongue, and you need to get an interpreter. The spokesperson in each family may differ no matter what the custom is. It may be that usually it is the oldest son, but family circumstances now dictate it's the youngest daughter. Always check and do not assume. It is important to reiterate that the view of the patient may differ from that of the spokesperson, and hence there may be some difficulties or politics surrounding meeting of the needs of the person who is ill and not breaching customary or familial boundaries. There is only one rule. Each person is an individual from a distinct culture, so we must learn from them and that culture. Treat each person as an individual. We must ask how we may help, and we must listen to the response. Our mere presence as a person who cares will be a significant starting point.
Embalming is not mandatory in this country, correct?
No, it's
You
not.
can opt not to be. Can you opt for different fluids, say like
Because of the freedom.
Gosling's rum, and start like several years before you
You
die?
probably can if you find someone who can do it for you. It's part of the burial and death practices are protected by the freedom of religion and the Constitution. So almost anything goes as long as it's within safety codes.
Right.
Yes.
You stated the price of the diamond thing, but you didn't state the price of the outer space.
Yeah, I haven't heard that yet.
How does that work, Ian, with the diamond thing? How does the body?
The human body, when it's burned, turns into
Oh, so
carbon.
they cremate it and then
They cremate you,
Oh, okay.
and the carbon is then filtered and made into very high density graphite. The graphite then is put into a press, and now they are making synthetic diamonds, basically accelerating the geological process of diamond making under thousands and thousands of tons of pressure. They can create a diamond out of graphite, and that graphite came from you. So I think it's $3,500 a carat. Yeah, and one of my goals is to be able to give a carat of myself to every loved one that survives me. My birthstone is April's diamond, so I might as well make it my death stone. You know? I think it's kind of a neat way to go. I don't want to take up any space on the earth. Maybe a memorial bench overlooking something would be nice. You know,
But still, with that, I mean, I'm assuming carbon is collected as collected as a gas? Otherwise it's
no,
just ash.
no, carbon.
The ash.
Carbon
Oh, so
is
it's
not
the
a
actual
yeah.
ash.
Carbon's not a gas.
Yeah, but it said it captures the carbon when.
Yeah.
Right. It's not the capturing of a gas, though. It's just the collection
Of the
the ashes. And ash is made of carbon. Carbon is in all human beings, and it's in all living creatures is carbon. And when everything else burns away, all that's left is carbon. So that can be then compressed into diamonds.
And the space burial, Professor, what happens if the ashes crashes?
So if you have a fatter person, do you get a bigger diamond?
Yeah, if you pay for it. If you
Maria's
pay
like,
for
I'm
it.
taking
Well, thank you.
Thank you.
Thank you.
Please don't bury me down in that cold, cold ground. Well, I'd
All right,
rather have them
Dana.
cut
And
me
there's
up
my
and
reference.
pass me all around.
All right, Dana. You gotta kill him.